The first way of food travel from mouth to stomach, and the second way of food travel from feeding cap to stomach, and the stomach gas escapes through feeding cap to atmosphere by avoiding the sound burp. The third way of food travel is swollen food, drinks, and alcohol can taken out from our body before it reaches to the stomach. A blocker helps to prevent the passage between the esophagus and stomach. It helps to maintain the health and weight. It also acts as an additional air passage for our lungs. A blocker is in closed condition during sleeping and prevents the passage between the esophagus and stomach. Atmospheric air enters into the E-junction tube, esophagus, and reaches the lungs. It avoids the snoring and sleep apnea. Thanks for watching.